Hey Jules, I'm glad you could join me for this quick short video. It's all about nursing tips and how you get your day started in the morning. So I'm going to start off by telling you how I get my day started. I feel like sometimes when I come in right at the time I'm supposed to be there, which is between 6:30 ish and 6:45, that I don't have enough time to get things done during the day or look at my patient's chart to see what they have going on. I'm the type of person that I like to keep up with my things during the day, and I have to stay on track, and I have to have something that kind of helps me stay on track. So basically, I get there early. So I will get there around 5:50. That gives me about 35 minutes to look over the chart of my patient. And I normally use a face sheet, and I fold it and I write on the white sides of the face sheet. I don't have a real face sheet here or any real patient information. I repeat, this is not real patient information. This is just something I wrote down, numbers and stuff out of my head that I was thinking of, that I put on the paper to just give you an example of how I get my day started. So right here, it says patient sticker. So I take the patient sticker so I'll know which patient I'm looking at, who I'm on, so I don't have to constantly open this face sheet and see who it is. I put the sticker on the outside. The next thing I do, if you can see, and I'll leave it here for a while I'm talking, is I put meds. So right here is not what type of meds they get, it's the time. Because you know, in nursing school, they always talk to you about working with time management. Well, some of the medications may be time sensitive. They may need to get an antibiotic before they go off to surgery. So this gives me around what time I need to be there. And as I get done with them, I take my pen and I just cross it off my list. The next one is a set of labs. Again, everything on this paper is fake. And this just helps me keep up with something that I want to keep my eye on. The one that I probably should have put on here is a crit. Maybe my patient needs some blood. But you get the drift of it. So if you see the doctor during the day, hey, their crit was this the day before, today is this, I feel like it's trending down. You need to know these things about your patient so you will not be in front of the doctor feeling crazy. Looking crazy. Okay, so the next thing is my vital signs. 133 over, what did I write? 60. Okay, so you know, if it's 133 over 60 and it goes up to 200 over something, that's concerning. You need to take that blood pressure again just to make sure. You need to call a doctor. Okay, so this is why I have that on there. The next thing on here is like new orders. You know, throughout the day, the doctor puts in new orders. You need to check. You need to actually put them into action. And they can go right here. Sometimes you may clear them out the computer, and then you may have to go back in and look at the actual orders. Why not look two places or look one? I don't know. Some people don't put their orders on the sheet. But again, this is just tips. Maybe you can take pieces of this and get your day started as well. In the morning, like I said, I use the face sheet. You can get handoff on the back of it. Questions or concerns for the doctor from the patient or for you for when you see the doctor. That's one. The next thing is the time that I went in the room, so I can know if anything happens. When did I last assess them? I don't know if you work on a different floor, like a step down floor. You may have to do vitals Q4. So I went in there at 8:30, you know, Q4, I may need to go back in there around 12:30. So I'll know when I need to do something. And in the morning, I always look at my progress notes. Another part of nursing is their length of stay. So, you know, case management handles that portion of that part, saying, well, the patient may need to be discharged on this day. We feel like, you know, they're better. What did the doctor say? What did the note say? So on the inside, what I normally do is I have progress notes. And let's say I saw a note in there that said cabbage on Saturday. So if they have cabbage on Saturday, coronary artery bypass on Saturday, obviously, you know, they're not going home anytime soon. IV antibiotics. They can't go home on IV stuff. So I have that. So what I'll do in the morning, hey, Dr. ABC123 said that this patient is going to have cabbage on Saturday and they're still on IV antibiotics. Then they can determine from there when to set the discharge date. So this is just tips for, you know, just for new nurses, how I get my day started. Some more tips on that note would be to, anytime you're going in that patient's room, be sure and check your orders, because you may be going in there to give medications and the physician may have changed the dosage on the medication. So, you know, you want to try to avoid med errors. So that's another thing you can do. It saves you time from being like, oh my God, this says 20 milligrams of whatever, and then on here it says 10 milligrams. Well, they changed the dosage on there. So to keep you from giving that 20 milligram, you can either split it in half and that'll be your 10, or, you know, wait on pharmacy to bring the rest of it up. That's just an example. It's not saying that's what you should do, but it's just an example. So you might need to give a dose that's 10 milligrams instead of 20. So always check your orders. That's what I'm saying right there. Also, when it comes to time management, for new nurses, I feel like a thing that we have problems with is delegation, especially when we have MAs or CNAs that are older than us, have been there longer, and sometimes it can feel kind of weird delegating them things to do. But just remember, you're super nurse, but you can't be super nurse all the time. You have to delegate those other tasks to the MAs and the CNAs, because you have things to stay on track with that you need to get done. You don't want to delay care for your patient, going to get them a cup of ice and 10 blankets, and you know you need to hang an IV over here at this time. This one is getting ready for surgery. You may have to pre-op them. So you have to learn how to delegate. I know this is like a whole bunch of boom, but that's nursing 101 for you. My next video that I'll have coming up is how to deal with difficult doctors. I hope this video has been helpful. If you have any questions on how I get done with my day, what do I do at the end of the day, what do I do about difficult patients, then like, comment, subscribe below, ask questions. I will definitely answer them. All right, Jules, later.